I work at Heights Christian, and I work with a variety of different children that just have, they just learn differently. Just precious little boys and girls that I get to interact with and try to figure out how we can best help them thrive.
And Mary's an alum from Biola and has her multiple subject credential, her special education credential, and I have the privilege of working with her husband, who is my associate dean here at Biola University. Also the privilege of having 2 of her children in my first grade class. All right, Robin, Dr. LaBarbera.
I'm Robin LaBarbera, and I'm a professor here at Biola in the School of Education. I'm the director of special education. So if you are earning your special ed credential or want to, you'll come see me. And I'm writing a textbook now on autism, educating students with autism. So I'm realizing that I don't know very much as I'm trying to write something. But yeah, the more you try and tell somebody something you know, the more you realize, I don't really know anything.
You know, and that's really, isn't that what lifelong learning is about? Dr. LaBarbera has 5 advanced education degrees, and she just said, I'm writing a textbook on autism and I'm realizing what I don't know, right? So this is a burgeoning frontier. We're all learners together in this. So, and Dr. LaBarbera started teaching primarily in the Los Angeles area and worked with elementary and also was a therapist. And Dr. Reed.
Hi, I'm Denise Reed, and I am also a professor here in the School of Education. And I have a passion for going beyond the labels and what happens in the classroom and accommodating students with disabilities, as well as how we as educators and professionals perceive difference, whether that be racial, gender, ability/disability, religious differences, and what do we do after the label is given.
All right, thank you. And so as we begin, I know that David asked each of you just to maybe give a response to some of the things that you've heard from Tania. So how about if each of you just give a little bit of a response, maybe something that triggered in your mind, a child that you worked with, or a question that you might have. And so let's just let each of you respond briefly, and then we'll start diving right into our questions. So would you like to start for us, Denise?
Sure. I just wrote down a couple of things, and one of the things I've thought about, I wanted to first of all thank Tania for actually doing such a wonderful job on talking about the differences between the qualitative and the quantitative analysis and what goes into looking at that data, and to express that there's a difference, the value in looking at both of those types of data. But I also wanted to say that as she was speaking, I began to think about what happens in the classroom after the label is given in terms of how teachers perceive difference and they perceive that label. And I just wanted to challenge the audience to think about 2 types of perspectives, the medical model and the social model of difference. And this is from a disability studies perspective, and when we look at the medical model, we're basically looking at the deficit within the person. And a lot of times it's experienced that individuals, teachers, the deficit is only in the person and the child. And so we get stuck there and we don't go look at the environment. Whereas the social model, we actually look at what's happening in the environment, including if there's any barriers, any attitudes that we might hold regarding children that have certain labels. And so we need to look beyond just, okay, we have a label, but what do I do with that label? Do I have an attitude towards children who are labeled having attention deficit disorder? Do I have an issue with children who express themselves in different ways? And so I wanted to just stress that, to look at other factors such as from the social model perspective, and look at issues regarding the environment, your attitude, the classroom structure, and the school structure, and to see if anything that's being that could be potentially a barrier is there.
Thank you, Denise. And how about you, Robin, in response to Tania's presentation?
What struck me the most throughout her conversation was that there is great importance on giving a complete battery, doing a complete assessment, because if we don't have a full profile of a student, we're likely to give an inappropriate intervention or have inappropriate expectations. And that reminded me of a time when I was asked to observe a student with autism, and the teachers were having a great deal of failure in seeing progress with that kid. And so they said, could you please observe him and make some recommendations? And I said, okay. So I observed him, and I could tell within about 5 seconds, he didn't look like he had autism to me. I'm not a diagnostician, so I couldn't make that diagnosis. But to me, he didn't show some of the typical characteristics, so that made me think the interventions they were trying with him didn't fit him. They had no idea what his strengths and weaknesses are. He could have a conduct disorder. He could have sleep deprivation or nutrition issues, any number of things. And so if you don't have a really full picture of the child, you may not be able to address what you want to. So that really struck me.
Thank you, Robin. And Mary, what struck you as you listened to Tania share?
I think a couple things. One is looking at the strengths and the holistic, like you were saying. I just got a feeling from her of her heart for these children, and that it's not just, I have this clinic, I'm looking at this kid with these tests. It was, how can I see this child as God made them and really understand them, using the abilities that God has poured into her life and the time and effort and education to really know who this child is and how to help them thrive. And it's a love for the children.
Yeah, thank you, Mary. How many of you did hear that passion? It's just the love for the child. Yes. And that's really what we all want, right? Is to love our children fully and thoroughly and to understand them better and then be able to help them. All right, so I'm going to throw out the questions from the audience, and then any of you can respond. As the field of psychology has made advancements, we've been able to classify disorders that previously perplexed us. Is it possible that we all have disorders and that there is no standard in regards to intelligence, learning, etc.?
Is that one mine?
I think it's Tanya's question.
I think I kind of touched on this before, which is the idea that we all really are exhibiting different traits of things. So we all exist on a continuum. Some of us do some things better than others. But it's really about when someone is unable to thrive. I really think that's the issue. I think we do get held up a lot in terms of criteria and intelligence. But it's about how to allow someone to do the best or be the best that they can be given the abilities that they have. And so the whole point of a label, if you will, is just to allow for good intervention, but not to categorize. So I don't know if that really does answer, but yes, none of us are normal. I'm saying that on. We all have different strengths and weaknesses, and unfortunately, we do education in a certain way in this country, and so a lot of our children then have a hard time maybe accessing information because it may not fit their model of learning. So it's just about figuring out how best to help them.
All right, thank you. And Denise?
I just wanted to say two things. First of all, I think that you mentioned it, Tania, in your presentation regarding how we as adults, we require so much of children. We expect them to read well, write well, speak well, interact well, when we don't expect that out of adults. And so, we have to think about that too, that even in our own expectations that we should not put those on children and put that unnecessary burden on children.
Okay, any others of you want to comment on that? Well, that's really a great question to start with, isn't it? Because it's really about differentness, isn't it? Different design, and there may have been something that has happened neurobiologically early on, and so then that child needs certain types of accommodations in order to thrive. It's about the individual child, cultivating a love for them and giving them a good learning environment in which their difference cannot be a handicap to their learning progression, but to be an asset to their learning progression. Next question. So in regards to the social issues, could you comment about changes you are seeing because of the technological advances and what that is doing to social interactions? Who wrote that? Great question. Great question. Who'd like to jump in on that?
Me too. I can't profess to be an expert in this. I think that we live in a technologically advanced world, so it is normative for us to expect our kids to have some kind of technological advancement, right? However, yes, there is actually quite a bit of research now that has begun to come up just in terms of what too much technological exposure does to things like attention, things like being able to deal with more bland and boring information, which you still need to access in life. So I know that it does something to impact how we access and how we interact in our environments, and socially as well. So if we have just gotten used to being more stimulated through technology, it could be that social interaction, which is for the most part difficult for all of us. Some of us do better socially than others, but it's energy invoking. We have to spend energy on it, and if technology is easier, we will tend to kind of default to that. So I guess the simplest way to answer this without getting myself into trouble would be that too much is not good. That needs to be monitored by the parent. And yes, children should be going outside and playing and spending time with other kids, because that's part of their development and hopefully their normative development as social adults. Yeah.
Any others of you want to comment on that? I just would like to briefly comment that in another parent-professor panel we had a few weeks ago, that there was the comment of a parent who said, I only let my child on the iPad about 20 minutes per evening. And the child was complaining, that's not what my friend's parents do, but the parent said, well, that's okay, but that's what your parent does. And there was a suggestion of pulling back from technology. And I think Tania alluded to this too, about interruptions of sleep. Mm-hmm. When children are on technology, or adolescents are on technology, or adults are on technology, mm-hmm. late at night, something to consider to step back from technology the last few hours of the night, mm-hmm. prior to your sleep.
What was the information on that? A certain amount of time before bedtime?
So I would definitely encourage you to read up on it, because I don't want to give the wrong information, but there's research that shows that blue light, so the blue light that is emitted from our iPads, our computers, does actually play a role in interrupting our REM sleep, and so you may actually fall asleep, but you're not necessarily getting as good of a night's sleep as you would get if you are not on the internet or computer so close to bedtime. And I'm not sure of the time range. I believe it's like 2 hours before you go to bed that you should actually shut things down, which for most of us is not happening, because we all go to, well, I don't want to say we all do it, but a lot of us go to bed with our technology, right? We're watching or we're reading a book on our iPad, or we're scrolling the internet on our phones, and that's all going to hurt the depth and quality of your sleep.
So that REM sleep that Tanya's referring to, of course, is a rapid eye movement sleep, where we have our deepest rest during the evening. We go through cycles of that about every 90 minutes, and we want to have several of those cycles in the night.
And that plays a role, I know, not to go off on a tangent, but that does play a role in cognitive development, both for children and adults. So what you learn, how your brain heals, the healing of your brain of toxins occurs in REM sleep. So you can imagine if you're not getting that, it's also going to impact your cognitive ability.
And of course, that question was also addressing the social aspects of media. So we see a lot of transformation of one-on-one, face-to-face conversations going into the technology, and students being less able to speak to one another in holistic conversations. Any additional comments that any of you'd like to make in that area?
I related to that, I've seen a number of emails from students that, in my opinion, should be more professional, but sometimes they're just, hey, what's up, LOL, and I'm like, maybe not so much, but that's just what they're used to. I'm not necessarily saying they're a problem. It's just something they're used to, texting or Facebooking or whatever, and maybe it's causing them an inability to separate professional from personal, things like that. I don't know.
And it's a dramatic difference from our historical past, right? Where rhetoric the ability to speak publicly and to interact with others publicly, to defend an opinion and share argumentation would enhance. It would be a sign of a high level of education, right? But it's a social exchange. All right, the next question. Excuse me. How does someone who does not have financial access to resources receive services that we discussed for their child?
That's a really, really hard question. It is unfortunate that for a lot of this, there's a lot of out-of-pocket expense that goes to the parents. There have been recent changes, however, in terms of insurance companies covering autism assessments as well as ADHD, and that's actually more recent. So the good news, if there is any in this area, would be that insurance should cover those forms of assessment. Now, one of the kind of small caveats there is a lot of people who do this kind of work don't trust insurance companies, so a lot of that would have to be you getting reimbursed from your insurance once you've paid out of pocket. So that's unfortunately somewhat true here in the Los Angeles or Southern California area. The other thing is that while I was training, in my training experience, the clinic I worked in, which was a part of UCLA's Help Group program. So if you guys are familiar with that institute, the Help Group helps children with special needs and specializes with autism. But they actually took Medicare, Medi-Cal, I always mix them up, for children who came from low-income households as well as foster care or adopted children. Those children did tend to come into the system with that kind of financial aid, and they could get an evaluation fully covered by Medi-Cal. They wouldn't have to pay anything for it. I always tell my students, my graduate students, when I teach on this class, is that in many ways the very wealthy are okay and the very poor are covered. It's generally the low middle class that have to pay out of pocket. And that is unfortunately still true. A lot of pediatric neuropsychologists will provide pro bono cases depending on need, but obviously not enough to fulfill everybody's need. So I don't have a very good answer for that at this point.
Let me just ask a couple specific things then from the panel, because you're giving us a glimpse of kind of the overall picture. Mary, if someone in your school needed to be assessed, now you're in a private school, but what would probably be the assessment path? Go ahead and take the microphone there. Yeah.
We do some at our school, but then we also refer children to public school because they're required, and they're really good about it. So they can get the psychological assessment that the public school offers. Caveat on it, is it going to be the same thing as you would get from a pediatric neuropsychologist? No.
Okay. So at your private school, you're working in tandem with your local public school for the assessments that we provided there.
With ours, it's the SELPA.
The SELPA. Okay, so could we pass that mic over to Denise? Denise volunteers every week with the Fullerton School District. And while you're in a regular ed classroom right now, what would typically be done in that public school if you had a referral for testing?
It would be that you would go through whatever the channel is set up in that particular district or that school, and you would make the referral and then contact, it would go through the channel. What needs to be done, first of all, is pre-referral interventions, RTI. We want to make sure that children go through a process that they're just not put into or referred to special education immediately without making any accommodations or making sure there's any things that, instructional strategies that may alleviate the issue that we're seeing. And then go through, if that doesn't work and they go through the different tiers that are identified in terms of instructional levels and various interventions, then an assessment would follow.
Okay, so everyone lives in a particular location. Your tax dollars support your local public schools. So there are tax dollars already, whether you're homeschooling or whether you're in a private school or whether you're in the public school, that should support some level of assessment. Is it the same level of assessment that Tanya's been talking about? Absolutely not. So then that's the case where you want to use your medical insurance, right? Okay, let's go to the next question. Are school psychologists following a tailored assessment? Do you know if this is common practice?
That's a good question. I am not a school psychologist, but from those who I have spoken to, I have been told that that's the frustrating part of their position, is that it's a canned assessment, and it's the same assessment for every single child that they see, and they don't meet the individual needs of the students, such as we heard today.
So, and I would say there's probably some variation on that. So for some psychologists, they may have a set of assessments that they utilize, but for others, they may have a wide range where they are selective in between, depending on symptoms. I think that was a really great description that Tania gave to us, which was that she doesn't use just a canned set, right? But it's like looking at the symptomology. And I know we have some psychologists right here, school psychologists here in the audience, and so I'm sure there's some variation on that depending on the symptoms. So the second question from this particular person was, does 10 to 15 observations help create a hypothesis? Is more time needed, for example, spending longer periods of time in the classroom? So maybe, Tania, you could start with us on that. And I'm sure it varies from child to child, but what does it take to actually have the enough observation time to make a hypothesis about which direction to go with assessment?
Yeah, it really actually is very hard to give a specific response to that. It depends on the child, it depends on what's going on, it also depends on the context. Because you can sit and observe a kid 10 to 15 times in the same context and not see much or not see enough. And so it's really about what kind of observation you're doing and under what circumstances. Different disorders will manifest themselves more clearly in certain settings versus others, right? So there's really no specific way to answer that. Yeah, sorry. 10 or 15 minutes just once. Yeah, that's not enough. Yeah, observing a kid for 10 to 15 minutes just once is not going to tell you much. But also it depends on the eyes looking at the child. Do you know what you're looking for? Do you know what could be an explanation for the symptoms that you're seeing? So that question really is a much bigger one. Yeah.
You know, and I'd like to just say that, Tania, even from your presentation today, I feel like all of us will have at least a deeper insight when we're observing children and thinking about interventions just by hearing some of the things that Tania shared today. Now, this next question is about helpful things to say to students prior to assessment or prior to therapy. And I wonder, Robin, if you'd like to start with this, like, how do you explain to an adolescent or to a young child that they're about to be assessed or that they're about to have some therapeutic practices that go beyond their regular studies? How do you approach that?
Well, I haven't done much in the way of assessment, so I don't have experience explaining to a child what's about to happen. Probably Tania could speak to that a little bit more. But what this is making me think of is speaking to parents when their child is about to have an assessment or when their child has already been assessed and they've tried everything at every school and they're at their wits' end. What do I do? I think the important thing is to affirm parents. Explain to them, you have done nothing wrong. This is not your fault. Your kid isn't even at fault. Perhaps we have not done a complete assessment. We don't know how to meet his strengths and needs because we don't have a full picture of what they are. So let's find out what they are so that we can best help your child. Because I think a lot of parents may come to the situation feeling like they are at fault or they have failed their child or even the teacher has failed their child. And I wouldn't put blame on anyone. I would just say, okay, let's start from here and move forward based on what we can learn about a child.
And would all of you say that, like, in your experiences, that a lot of times there's a lot of tension around these things, right? Because parents are wanting their children to excel, the teachers want the children to excel, the administrators want the children to excel, the school psychologists want the children to excel, but yet they're stuck. We're all stuck at certain points. And so there's that invitation to work collaboratively, to work in peacemaking, and to really hear one another. Because it's not really anyone's fault, right? We're just working together to find out what that child's needs are and to move forward. Denise?
I just wanted to say on that note, I think too, when you were speaking about that, what came to my mind was the thought about school culture. And I think about how we in education, we operate on the bell curve, and what's normal, and if you're one deviation below or you're one deviation above, then you're either not okay or you're better than okay. And I think when we think about education in general, we have to rethink about what we think about what's normal and what's acceptable. So I think we have to think about school culture when it comes to that as well.
Anything else you want to add on that area? Mary?
I would like to, because I have the distinct privilege of being able to do this in a Christian school. And one thing, both of the parents and the children, that I want them to come away every time with is knowing they were created the way that God chose for His glory in their lives, and He'll use it. And the parents I work with sometimes, they're great parents. It's difficult for them, it's difficult for the kids. And I want them to realize that didn't take God by surprise. He knew that. And He's going to use it in the lives of them and their children in the way He chose. And that's the one thing I want them to go away with, it, realizing it's not a mistake. It's not something wrong. It's a loving God allowed this in your life for His glory. And we're all going to work to find out how to do that.
I love that reminder about the spiritual context, right? God knew you would be designed this way, and there are strengths, there's like sunny sides and shadow sides to every aspect of all of us in our way of thinking and our way of learning. So I'm reminded, as you shared, Mary, of Psalm 139, right? That He knew the days that were ordained for us before there was one of them. And so He knew the path that we would walk. He knew us in our mother's womb. And so we are His creations, His creatures, and we are just here to love each other and help each other flourish and to work collaboratively in our community. Well, this next question is one I think we'll all really be interested to hear your responses to, because the question is about sports. So Tania mentioned a lot about the brain today, and she mentioned a lot about the prefrontal lobe. And so we've probably all read the newspapers, right? And we've read some of the research maybe related to damage that can happen to the brain in the context of injuries. So what should parents and educators be thinking about that, Tania?
Bubble wrap their heads. No. I know there's a lot of talk about this, and it's in the media. And yes, I mean, football, high contact sports, unfortunately, are correlated with damage to the brain, can be, if you have repeated injury to the brain. So I want to say that carefully, though, because it doesn't mean, we tend to be very black and white people, right? So we say that, and then everybody stops playing football. And I think that would be detrimental to the American culture if that happens. But I think that it just, it's something to keep in mind. If you have a young child, male or female, who's in a high contact sport, if they get their head hurt, take them to a specialist. Make sure it's looked at. Make sure that there's a downtime of rest to allow that brain to heal, because it will heal, depending, of course, on the extent of the injury. So I think everything in moderation should be the mantra. But I totally resonate sometimes with the whole bubble wrap their head concept. But that's just not normal.
And keep those bicycle helmets on, right?
That's right.
Absolutely. Any others of you that would like to comment on that, Denise?
I have a colleague who I did my doctoral studies with. She's over at Laverne, and her field of expertise is actually concussions due to athletic
TBIs.
sports. And one thing that she is focusing on is a lot of times when it comes to sports-related brain injuries, we focus a lot on returning back to the playing field. And she's focusing on when are those children ready to go back to the classroom and be able to retain information through the academic channels again. So that is research that's coming out of Laverne University. And I just wanted to share that.
Okay, very good. Well, this probably last question that we're going to look at today is the question about one disability maybe being associated with another. So specifically the question was about, do you often have like ADHD along with some type of learning disability? So, what kinds of companion concerns do we have?
Actually, it's a very good question, and I did not get to touch on it on my talk. So, for example, with ADHD, it does tend to be comorbid with reading disorders. It's one of the things that you do tend to see so kids with ADD may have a higher chance of having a reading disorder, what used to be called dyslexia. So it actually is really important when you have a child who comes in with that disorder or inattentiveness, hyperactivity, that you check their reading. Because the mechanism of reading may have been impacted by the inattentiveness, or because certain brain regions that are not working completely well for attention may also not be working as well for reading. So that would be an example of comorbidity that would happen. ADD or ADHD can also be comorbid with depression and anxiety. Some children who have ADD, ADHD, the medication may lead to anxiety disorders, but the disorder itself has a comorbidity with them. Especially if a child has a disorder that's been ongoing for a long time and has gone undiagnosed, those children, again, feel really frustrated and begin to internalize the symptoms and think, oh, it's all my fault, I'm not smart enough, etc., and that then may lead to a depression or an anxiety disorder. So yes, with a lot of what we talked about today, there is comorbidity. Not all of it happens as commonly as people may think. So it is highly unlikely, and I'm saying this with a grain of salt also, to see autism and ADHD. The DSM, Diagnostic Statistical Manual, now allows us to actually give both disorders at the same time, but generally one of them answers the question. And so you want to actually be very careful, because so many kids out there may have both when they don't, are given, labeled with both when they don't have both. And that plays a role then with intervention and medication. So yes, a lot of these disorders may come hand in hand.
Okay, anything else that the panel wants to add to that question? Well, I want to thank you all, because I think that this team, up here we have parents of adult children, we have psychologists, we have classroom practitioner, we have university professors. We realize that all of us have to work together, right, to do what's best for children. So let's give this team a hand. Stay right up here, but let's give this team a hand, and then I'll invite David up.
We hope you enjoyed this message. Biola University offers a variety of biblically centered degree programs, ranging from business to ministry to the arts and sciences. Learn more at biola.edu.